Hey everyone, my name is Melanie and I am the social media manager here at PlushCare. PlushCare provides virtual primary care and mental health treatment to patients nationwide, all in the convenience of our free app or your browser. We're here today for a Q&A with PlushCare's newest therapist to join the team, Melissa Dowd. Before we jump into the Q&A, Melissa, could you introduce yourself?
Yeah, thanks, Melanie. Hi, everyone. My name is Melissa Dowd, and I am a licensed marriage and family therapist in California, and I'm super excited to be joining the Plush Care team.
Thanks for joining. I guess one of the first questions is, do you specialize in any area of therapy?
So, I actually provide therapy under the model that one size does not fit all. So, I utilize many different therapeutic modalities based on whatever it is that my client is coming to me with. Typically, I will utilize a lot of CBT, which is cognitive behavioral therapy. So that focuses a lot on what are we thinking and what are our behaviors around that. I also utilize a lot of psychodynamic, which kind of helps to bring the unconscious conscious. So, what are some patterns that we're repeating that maybe aren't that helpful, and we want to readjust those? And I also utilize a lot of mindfulness based therapy techniques. So, to really help kind of manage our feelings of depression and anxiety and get us into the here and now. Solution focus is also a really great one. Sometimes people come to me and they have a very specific struggle that they want to work through, and solution focus just focuses on what is the struggle at hand, how can we make some changes and see what works and doesn't work. But again, it just really kind of depends on what my client comes to me with and what is going to be the best fit for them overall.
Mhm. That's awesome. Thank you for sharing. Could you tell us a little bit more about what attracted you to PlushCare?
Yeah, definitely. So I really do think I was living under a rock before I came across PlushCare. I was under the impression that you had to be part of a larger healthcare provider in order to get the services that PlushCare offer. But when I came across PlushCare and saw that there's these on-demand virtual healthcare appointments and also including therapy, that really appealed to me. I think it really makes therapy and doctor's appointments so much more accessible to the greater population. And the other thing that I really appreciate about PlushCare is from a clinical perspective, it's really wonderful knowing that when I refer my clients out to potentially getting a medical evaluation, let's say we think maybe some medication might help with their symptoms, that I can feel really confident that I know they're going to get really wonderful care and they're going to get care in a quick amount of time. Oftentimes, if I need to refer out, sometimes it can take weeks for someone to get that medical evaluation. And so being a part of PlushCare means that we work in a team environment. And I think that that really benefits me from a clinical standpoint and then also our members.
That's great. Thank you for sharing a little insight and a little deeper into that. Before we go into more questions in this Q&A, I did want to ask you, what do you yourself, Melissa, what do you like to do in your free time?
Good question. Well, my answer pre-COVID is different than my answer during COVID. Pre-COVID, my passion project is actually volunteering with endangered wild animals around the globe. I had it on the books to go this year, but unfortunately that didn't pan out. So we'll see what 2021 brings. But during COVID, any opportunity to get outside and be in nature is what I really love. And I live in San Francisco and so fortunate to be right here near the Bay. So beaches, spending time with friends and family. And sometimes I just like downtime too. Sometimes it's, TV, Netflix.
Mhm. That's great. Fingers crossed for 2021.
Yes.
Great. Okay, moving on to the section of virtual therapy in general. One of the questions is, what is virtual therapy like?
Yeah, that's a great question. To be honest, it's actually very similar as in-person therapy. So you'll meet with your therapist depending on the platform, but you'll meet with your therapist through a video session, much like what we're doing right now. And it's from the comfort of your home, which is really great. So there's still this level of confidentiality and privacy, and really comfort because you're in your safe space.
And so you would say that would be the biggest difference between in-person and virtual therapy?
Yes, I mean, definitely. When we are in person with each other, there are a lot of, there's a lot of energy between two people that's sort of unspoken and things that we can't see. There are a lot of verbal cues that are, sometimes missed because we're not in the same room together. And then, as a therapist, my job is really to create a very safe and contained environment in my therapy office for the therapy sessions to take place. And of course, that's different in a virtual setting, but not to say that we still can't have a really safe environment, but it's just we're, through a screen and you're over there and I'm over here.
That's great. Thanks for sharing. How long does each therapy session normally last?
Typically, therapy sessions last between 45 to 50 minutes. That's a pretty standard therapy session.
Hmm. Okay, great. And if I were, for example, looking to find a therapist online, what would you say I should be considering when I'm looking for one?
Yeah, it can sometimes be a daunting task. I know that I often get asked, how do I find a therapist? So, when searching for an online therapist, I think one of the good things to do kind of initially is determine what sort of care, what level of care are you hoping for? Are you wanting talk therapy? Are you wanting to message with your therapist and text with them? How much money do you want to spend and how much time do you want to invest in it? And then I think once you have those questions answered, then you can sort of narrow down between the options that are out there. And another good thing to do is if you have a therapist friend or someone in your network, you can ask them for help on finding the right fit for you and referrals. You can ask friends and family. Oftentimes a lot of people are in therapy and we don't even know it. So if we kind of reach out to our network and ask around, we might be surprised at the resources and referrals that we can get through them.
That's good. It's sort of like a group effort kind of thing.
Yeah, yeah, definitely. Like I said, it can be a really daunting task. And if it's something that we feel like we have to do alone and we don't have support with even finding a therapist, that can feel really overwhelming. So, absolutely, I definitely encourage people to reach out and ask around.
That's good to know. Thanks. Um, and one last fun question for virtual therapy in general. Is therapy just like how one would see it on TV or in the movies?
I love this question. No. The big answer is no, it is not. Some TV shows and movies do a really good job at representing what a therapeutic relationship looks like, but I have to say, more often than not, they don't. There's a lot of inappropriate dynamics and relationships that I see occurring between therapist and client on TV, and I can assure you that that should not happen in real life.
Hmm. Okay, good to know. And then I guess moving forward to general therapy, how often would you say someone should meet with their therapist?
I think it really depends on the person, but for everyone, I always recommend initially when you're first starting out with a new therapist, I would commit to meeting with them weekly for a period of 3 to 4 weeks. So one time a week over 3 to 4 weeks. And then once you get to that point, that really helps to build rapport and trust with your therapist. They get to learn so much more about you. And from there, you can determine, the two of you collaboratively can determine what kind of care is best for you. Maybe from that point, you want to go to every 2 weeks. I would say anything beyond every 2 weeks can get a little bit tricky because what ends up happening is, let's say you go 3 to 4 weeks between your sessions with your therapist. Oftentimes, then the therapy session just ends up being a catch up session. And so you're trying to let them know everything that you've done over those 3 to 4 weeks, everything that's happened, the things that you've been struggling with. And then once you've done that, you're already like, let's say 30 minutes into the session. And now you only have about 15 to 20 minutes to really delve in and kind of work through the struggles. So my recommendation is always once a week for the first 3 to 4 weeks. And then after that point, if you feel like you're doing really well and you want to go less, then I think every 2 weeks sounds like a good fit. And again, that would be a really good question to ask your therapist when you two are working together and you both can decide what's the best level of care for you.
That makes sense. So consistency is sort of key here then.
It is, yeah, absolutely. If we think of anything starting out, we want to do it. Consistency is a great word. We want to do it consistently because that's how we build any momentum. Let's say we're trying to start or learn a new instrument. Well, we don't want to pick it up once a month. We're
Mhm,
probably not going to get very far in a short amount of time. So yeah, it's a good way
mhm.
to look at it.
Okay, yeah, that makes a lot of sense. Um, as a social media manager myself, I see a lot of mental health content on social media. I was wondering what your thoughts were on the intersection between social media and mental health. Do you think it helps?
I actually really appreciate that more mental health awareness is out there on social media. I think Instagram is a great source to get some tips and tricks. There are a lot of therapists who have their own Instagram business accounts. I actually have my own as well. And so if I come across something that I think would be helpful, I always share it and then give like some general information about it. And you can find that all across Instagram. There are people who have pages that cater towards mental health related issues and quotes and all of that. And they might not be a licensed professional, but that actually doesn't mean that it's not helpful. So I actually think that social media is a great way to bring awareness to mental health. I think it's helping to destigmatize seeking professional support. And oftentimes my clients will say, hey, I found this really great post or quote on Instagram, and can I share it with you? And when they do, I'm always so surprised, pleasantly surprised by it. And I definitely feel that it is helpful. So I think it's good. Like everything that's online, we want to take it with a grain of salt. We don't want to use that as, always as fact. But I think if it helps someone, then absolutely.
I agree. So it's good that there is some work going towards destigmatizing the topic.
Absolutely.
What happens after going to your first online therapy session?
So typically in the first session, whether it's in person or online, you're going to give a little bit of background and history to your therapist about what it is that you're struggling with, why you feel therapy is a good fit for you now, and the things that you really want to work on moving forward. So you kind of, the therapist gets a sort of a general overview of what's happening. And then typically I'll speak to myself at the end of a therapy session, whether it's the first one or the 10th one. I always provide strategies and tools that I would like my client to work on over the next week. So oftentimes when you're done with your first therapy session, you'll have a good, maybe like 2 to 3 things that very clear things that you can go work on over the following week. And then when you meet for your second session, you can talk about how they went, what worked, what didn't work, where you're at, and then kind of move forward. So that's a pretty standard first therapy session.
Makes sense. Yeah, thank you for sharing that. When you're thinking about pre-COVID versus how the current state of things are now, how is therapy different, if at all?
I think one of the main differences is it's essentially all virtual at this point. And, way back in March, I mean, we all, me included, we all transitioned from in person to virtual therapy. So I think that's been a huge difference. And I actually think it's a really positive, it's a positive difference because it is allowing people to have access to the level of support that they need from the comforts of their own home. And right now, with all of the uncertainty going on and with different people's comfort levels around, leaving their house and being out in public, I think it's really great. It offers consistency of care. And the other difference I would say is I'm actually noticing that more people are open to the idea of seeking therapeutic support. It wasn't maybe necessarily something they would have been open to pre-COVID, but we are all experiencing a lot of loss, and that looks different for everyone, but we are all experiencing loss. And this is something that none of us have had to endure before. And so we might not necessarily have all of the tools and strategies we need in order to manage what it is that we're feeling and how we're coping with it. And I think because of COVID and because of the state of the world right now, people are more open to the idea of seeking support. And I think that's a wonderful change that has come of it.
That's good. I agree too. I think it's a wonderful resource to have during, especially during this time.
Yes.
I did want to ask some questions about the effectiveness of therapy. One of them being, what does research say about the overall effectiveness of therapy? Does it differ between in-person and virtual?
Really great question. So actually, research shows that in-person therapy versus virtual therapy is essentially just as effective. Virtual therapy is very effective in treating many mental health concerns and struggles, and including depression and anxiety, which a lot of us are experiencing right now. So yeah, the research shows that virtual therapy is just as effective. And it's no surprise. I see it in my own practice too. Some of my uh, kind of greatest and most fruitful sessions have been through virtual therapy.
That's good to hear. Relieving to hear, actually. Um, how can I tell if therapy is working for me, and how do I know if it's not?
Another really great question. So, what I would recommend is just take a step back and reflect on your progress. Are you noticing any changes? Are you noticing that you're feeling better or that you're feeling more motivated or confident? Are you noticing that your relationships are improving? Are you better able to set healthier boundaries? Are your symptoms that you are experiencing, are they minimizing? Another great way to tell is, has anybody else noticed it? Oftentimes, when we're finding changes within ourselves, sometimes they happen so gradually that it's hard for us to really recognize them. But the people who are closest to us will often say, "You seem different," or "You seem happier," or "You look different," or your energy is different. And I think that's a really great way to have kind of some validation that you are making progress. And are you noticing those changes? I mean, that is really important. Like, what are you feeling? Sometimes your therapist will mention it too. I often tell my clients, I noticed such a change in you. Have you noticed it? And sometimes they think, oh, yeah, I get different responses and different answers, but sometimes it does take just reflecting yourself and then also seeing if anyone else notices. And let's just say you're struggling, you've taken the time to reflect and you're struggling to feel any differences or notice any differences. In that instance, I would really recommend that you talk to your therapist about it. That your relationship with your therapist is really one of the most safe and confidential and non-judgmental places to voice those concerns. And they might also say, yeah, I haven't really noticed a lot of progress, like maybe there's some resistance, or you have and you just haven't noticed it. And so even having that other perspective and not being afraid to ask.
That makes sense. Yeah, those are really great questions. I feel like you should be asking yourself those questions even if you aren't going to therapy. It's a good practice.
Yes, it is, of course, self-reflection.
Yeah.
Yes.
Moving on to the topic of medication therapy. On the topic of medication, can therapists prescribe a client medication?
No, so we are not licensed to prescribe medication. So our license really is all about talk therapy. And if someone is seeking some like a medical evaluation or feel they need some medication to help minimize their symptoms, then they would either visit a psychiatrist or go to their primary care doctor.
That makes sense. I guess on that note, could you tell us a little bit more about the difference between a therapist versus a psychiatrist versus a psychologist?
Sure. Yes, that could be a confusing one, especially if you're not in the field. So basically, the difference between a therapist and a psychologist primarily is around education. So a psychologist would have further education than a therapist. Therapists typically have a master's degree, and psychologists typically have higher ed. So they have either a PsyD or a PhD. And that further education for a psychologist is really around research. So when they are seeking their higher education, a lot of it is research based. So studies and all of that, things that someone might find when they, Google, is this effective? Or that's really what a psychologist further education allows for them. Both a psychologist and a therapist are very well versed in talk therapy, and so is a psychiatrist. But a psychiatrist differs between the other two in that they further have higher education, and they are a medical doctor and able to prescribe medication. So oftentimes someone will see a psychiatrist for a medical evaluation, and then medication management. Talk therapy, some of them do it, but most often they'll refer out to either a therapist or a psychologist for that.
On the topic of all of that, could you dive a little deeper into PlushCare's mental health program for us, and maybe let us know what makes PlushCare unique?
Absolutely. So, what I just so appreciate about PlushCare's model is that we really do help to provide care for the whole person. So, not only physical health, but also emotional health. We have therapists on staff as well as primary care doctors. And the reason PlushCare is so unique is that we really work in a team environment when it's appropriate for the PlushCare member. So they have access to therapists as well as primary care doctors who can not only help treat, medical conditions that they're experiencing, but they can also prescribe medication for symptoms such as anxiety and depression. So it's really a whole person model that a lot of other platforms don't offer, and it's something from a clinical perspective and a provider, it makes me feel so confident that I know that my client is going to receive the level of care that they really need. And then from kind of a member perspective, it's so great because it's all housed under one model. So it can be a really daunting task to kind of or to try and find a therapist or find a primary care doctor, get an appointment. But with PlushCare, all of that is really accessible.
That's great. Thank you for clarifying a little bit more. I did want to wrap this up a little bit, and one last question for you is if there was anything else you wanted to share with those that are considering therapy for the first time.
Yes, I love this question. My recommendation to anyone who is considering therapy is if it's on your mind, try it out. There's no harm in trying it out. And I think because so much of therapy is done through a virtual setting now, you get to do it from the comfort of your own home. Sometimes it can be a little bit scary because it's new and it's different. But in order for us to make any progress and grow, we need to challenge ourselves. And, if it's on your mind, if you're thinking about it, take that next step and just see what it's like. And it doesn't have to be a scary process. We're therapists are humans too, and hopefully we'll make it a really painless and easy process. But yeah, I just think that if you're thinking about it, just go for it. See if you can challenge yourself. I think 2020 is really kind of the year of putting ourselves outside of our comfort zones and challenging us to do things differently and think differently. And what an awesome opportunity.
Great. Thank you so much for all that information. And thanks for joining us today, Melissa. This was
Of
super
course.
valuable and insightful information. It's been great to get a closer look into the world of virtual therapy and what it could do for PlushCare's patients specifically.
Thank you so much. Thanks for having me.